The latest scare of the HMPV virus in China has people concerned. Human metapneumovirus, or HMPV, is a viral respiratory pathogen that affects people of all ages. It's particularly concerning for children, older adults, and those with compromised immune systems. Let's talk about the characteristics of HMPV. First, the discovery. HMPV was first identified in 2001. Now, regarding transmission, it spreads through respiratory droplets, contact with contaminated surfaces, and close contacts with infected individuals. As for symptoms, they are quite similar to those of respiratory syncytial virus or RSV. These include cough, fever, runny nose, wheezing, and shortness of breath. Moving on to the diagnosis of HMPV, laboratory tests such as reverse transcription polymerase chain reaction or RT-PCR are the most sensitive and specific method for detecting HMPV RNA in respiratory specimens. Serology tests like enzyme-linked immunosorbent assay or ELISA and indirect fluorescent antibody or IFA can detect HMPV-specific antibodies in serum. Viral culture is another method where HMPV can be isolated in cell culture, but this approach is less sensitive and more time-consuming than RT-PCR. Imaging features are also important. Chest X-rays and CT scans may show hyperinflation and peribronchial cuffing on CXRs. CT scans might reveal bilateral ground glass opacities and consolidation, as well as interlobular septal thickening and bronchial wall thickening. Treatment for human metapneumovirus, commonly known as HMPV, primarily involves supportive care. This includes oxygen therapy, hydration, and antipyretics to manage symptoms. In some cases, antiviral medications such as ribavirin, a nucleoside analog, have been shown to inhibit HMPV replication. Additionally, systemic corticosteroids may be used to reduce inflammation in severe cases. Preventing HMPV infection involves a few key strategies. First and foremost, practicing good hygiene is essential. This includes frequent hand washing, wearing masks, and avoiding close contact with infected individuals. On the horizon, several HMPV vaccine candidates are in various stages of clinical trials, offering hope for better prevention in the future. HMPV can lead to several complications. One of the most serious is respiratory failure, which can occur in severe infections. The virus can also increase the risk of secondary bacterial infections. For individuals with underlying conditions such as asthma or chronic obstructive pulmonary disease, HMPV infection can exacerbate these conditions. Human metapneumovirus is not new. We often see it during regular flu seasons. Most cases are self-limiting. However, post-bone marrow transplant patients, individuals with neutropenia, those with COPD, the elderly, and neonates are the ones we see in the ICU. Most of these patients recover well, and those who succumb are very few, often due to superadded secondary bacterial infections. Most HMPV cases are self-resolving, requiring only symptomatic care. Antivirals play a very minimal role and are rarely used, except in post-bone marrow transplant patients with severe neutropenia. In such desperate cases, treatments like IVIG and ribavirin are based on case reports rather than solid evidence. During flu seasons, we see a mix of viral upper respiratory tract infections, including flu, RSV, rhinovirus, and HMPV. It's not new or uncommon, it's been around for a long time. What's worrying this year, besides the flu, is the rise in Mycoplasma pneumonia, which is resistant to azithromycin but responds well to doxycycline. We don't know the real numbers in China, but one report indicates that along with flu and Mycoplasma, HMPV is also present, which we see regularly. HMPV is very common in our country. It's been around for a while, and we see it regularly on BioFire PCR panels. We should not fall for media traps. HMPV is like the flu. There is no panic situation at all as of now. The solution is to be vigilant yet calm. HMPV is not to be equated with the SARS pandemic. We should timely try to negate the panic and scare that sets in due to unrestricted social media blitz. By maintaining responsible vigilance of the worldwide situation and not contributing to the ongoing hype about an anticipated epidemic, we could better serve the larger cause of society. However, if there is a sudden spike in HMPV with unusual numbers and severity, then it becomes a matter of concern. In such cases, whole genome sequencing of the virus to look for major mutations causing increased virulence will help. We will have to wait and watch for the latest trends. Just stay alert, follow social etiquettes, and stay safe.